Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
Hi, everyone. I'm Dr. B and Dr. G, and this is another episode of AMG Vitality Vault. And today, Dr. G,
I'm excited.
We're going to be talking about peptides. So first, I want you to tell me which peptide are you wearing today?
Well, you know what? Because I think that this guy on my sock right now is one of the coolest superheroes out there. Because let's face it, he has a gadget for everything. I'm rocking my Batman socks today. Now, if you know Batman doesn't have any powers. He's a rich dude who just knows how to get out of every single situation because he has a gadget. And in this case, a peptide for every season. So let's
I'm sure he does.
He does. So we're doing the role of peptides in Regen Med. So peptides are near and dear to our hearts. Dr. B and I use a lot of peptides in our practice. We use them personally. And ever since we began using these therapeutics over the last couple of years, I would say that it's been a game changer for us personally and for our clients who have benefited from the knowledge that we have and using some of the modalities that we recommend to them.
Yeah.
So it's really something I want you guys to kind of do a deep dive on, do your own research. Obviously, listen to what we have to say, but check it out. And be careful where you get your peptides from.
Absolutely.
Be very, very careful. Just if it seems too cheap, then it's too good to be true because it typically should not be a couple cents for peptides.
And look at the fine print because there are a lot of places online that are selling these peptides. But if you look at the fine print, it says not for human consumption. Or it says for experimental uses only.
Just be very careful, guys, because there's a lot of charlatans out there selling stuff or selling just sugar water to you, and you're spending money on stuff. So just be careful. Find the provider that knows what they're doing, that has a reputable source that can get you where you need to be using peptides.
All right, so let's look at what are peptides and how do they work. So peptides are typically short-chain amino acids, and they're put together in a specific pattern to form different molecules. And these molecules signal cells to perform different functions, and so they create different benefits in the body, usually along the line of healing and regeneration.
And most people know peptides, Dr. B, from old school, from like high school science, right? Because an amino acid comes together with another one to form a peptide. More peptides come together to form a protein. So that's why we learn about peptides in the beginning. So, and people will say, oh, what about collagen peptides? And those are a type, but these ones are therapeutic peptides, meaning because of what Dr. B said, because of how they work and the conformation that they put in, they tell the body, different parts of the body, to optimize the way they're working. So it's more of a signaling molecule. And that's what we use.
And you may be thinking amino acids, like, is that all it is? But they're very powerful.
Very potent.
Just by taking one amino acid off that chain and replacing it with something else changes the complete compound and the function of that molecule completely. So it's very fascinating, these new modalities, peptides. All right. So here are a few peptides that we use in practice. And just to give you, and this is kind of like Peptides 101.
That's it. That's all it is.
So BPC 157, we have spoken a little bit about this before in some previous podcasts. So this is I think it's a 15-chain amino acid, and it mimics a compound found in the gastric juices, referred to as a body protective compound. That's what BPC is. And it helps with healing and repair. So it helps a lot with, yes, if you take it orally, which is what is available
Right
now. It helps with gut inflammation. It helps with digestion, any GI issues, even acid reflux, etc. But it helps all over the body. It's known for its musculoskeletal healing properties, and we use it before and after surgeries to help with healing. I could name so many different things, but it's kind of one of those foundational peptides that you can't go wrong with using it.
Yeah.
And really, I've never experienced anyone with a side effect to it. It helps you feel much better when you take in terms of your energy and just how you feel overall, reducing that achiness that some of us may have, etc. So we love BPC.
We love it. Now, next up is CJC ipamorelin. So this is an actual combo peptide. So there's two peptides in there, and they basically help to modulate or modify the way your growth hormone is delivered from your pituitary gland. So you think of this particular compound of peptides, CJC-IPA, as a coach for the pituitary gland. So they are growth hormone releasing hormone analogs or peptide analogs. And they tell the pituitary gland, hey, you know what? Why don't you release a little bit of growth hormone? So it's important to have this because as we all age, natural growth hormone production begins to decline. And I know, okay, you might be thinking, well, I'll just take growth hormone then. Careful. If you don't actually have a clinical diagnosis of growth hormone deficiency, taking exogenous growth hormone can be detrimental long-term because guess what? You're knocking out your body's natural rhythm of releasing growth hormone. See, most of us human beings, when we have growth hormone in our bodies, it typically goes through spurts in the way it's released from the pituitary gland based on the need for the day, which averages anywhere from 3 to 8 cycles in a 24-hour period. Now, if you inject exogenous growth hormone, guess what happens? You blunt that effect. It just sits in the system, and now you're chronically stuck at elevated growth hormone levels, which overstimulates certain tissues in the body and can put you at risk of developing certain tumors or developing these things like acromegaly in the body, which is not a good thing. So just be very careful with using exogenous growth hormone. But with the beautiful thing about the peptides is they're proteins, not steroids, and they're easily degraded by the body. So they go in, do their work short term. Usually, I think on average, anywhere from 15, most peptides are 8 to 30 minutes in terms of their availability in the body, and then they get denatured. They don't linger, but they turn on the system does what it does naturally, and then it cycles back down. So it's important to have that. And I love the growth hormone releasing peptides because they do help, especially taken at night on an empty stomach. They do help with good sleep. They do help with sleep. They do help with building that muscle. They do help with healing. And just like BPC, they do help with reducing inflammation and overall improving of longevity. Great peptide combo.
Next up, we have thymosin alpha 1. And this is another peptide, but it's made to resemble one of the is it a compound or is it
it's a hormone. Actually, a hormone, yeah.
Hormone that is usually produced by the thymus gland. Typically, your thymus gland completely disappears by about anywhere between age 5 to 8-ish.
Actually, it begins to peak then. And then when you hit your 3rd to 4th decade of life, that's when your thymus gland pretty much is set in its ways. And it doesn't do much else after that. It still has a little function, but it kind of begins to diminish in function. And that's when we see a lot of diseases begin to crop up.
So the thymus gland is responsible for immune function in the body.
T cells.
So thymosin alpha 1, it helps with immunity. So it helps to boost your natural T cells, which are responsible for helping you to fight certain viruses, certain infections, etc. So we position this in our practice, and it is an injectable peptide. we position it to help with overall immune function. And especially if you get sick, if you were to come down with COVID, the flu, any of those nasty viruses out there, taking this on a regular or increased dosage helps you to recover faster. So that's the one that we hold in our pockets or back pockets to help people with if they get sick. Or there's certain conditions that increases your chance of infection. So certain conditions, autoimmune conditions, et cetera, that this significantly benefit patients with.
Then we go into cimarolin and tesamorelin. These are also growth hormone releasing peptides that we have, that we have been using. And they do just like CTC ipamorelin. They just kind of help the body through metabolic and cognitive improvements, muscle improvements. So they're another one. And they are injectable or they can be sublingual as well. And next up we have, everyone knows GLP-1s. Now, there is a talk, Dr. B, about and I've seen the question in some message boards of other physicians, could GLP-1s be seen as a longevity molecule or a huge, or should they be put in the conversation when talking about longevity? What do you think?
I think with all the research and all the new advantages of GLP-1, it absolutely can be seen as a longevity molecule. So to begin with, the GLP-1 molecule, they hit the market for diabetes.
You did?
Right? To decrease the blood sugar, decrease your A1C, get your diabetes under control. And we realized that it was helping significantly with weight. So that was the big thing, the next big thing for weight loss. And we know there are a few out there in the market, diabetes and weight loss. But in the last recent years, they've been helping with decreasing your risk of cardiovascular disease, decreasing chances of MI, which is a heart attack. So it helps with cardiovascular health. We've been seeing improvement in kidney function.
Yes.
So if we look at it, it's like a regenerative therapy if it's improving with kidney function. And we're talking about people who have chronic kidney disease, not just something just recently, not acute, but more of a chronic basis. So kidney function, it's been even approved recently for obstructive sleep apnea.
I know, OSA, yes.
Yeah. So, and I might even be missing a few there, but
there's more coming down the pipeline. I mean, and from when you read the data on how it works, right? Anything that can help reduce, especially fat mass, because fat cells, as we all know, highly pro-inflammatory. Anything that can help reduce those will help the body do a lot better. So there's a lot of the way in which this molecule works to help improve, and there's more and more studies coming down the pipeline. So it is a good one to kind of consider on your journey to health. If you're someone who has certain criteria that fits the need for being on a GLP-1.
And in the functional medicine world, there's been more research on we call microdosing.
Yes.
These GLP-1s. So not necessarily the regular dosage to cause weight loss, etc., but very small dosing for longevity purposes, for overall well-being. It's been shown to help with decreasing GI inflammation as well, too, and just overall inflammation. So when we look at it from that stand view, then it does help with, it definitely is a longevity medication. And I think we have a lot more to learn from GLP-1. There's a lot of research that's coming down the pipeline. So we'll keep you updated. And
with these peptide therapies that we have, they all have benefits. And obviously, everything can potentially have side effects. And typically what we see in terms of side effects for some of these is more at the site of injection. You might get a little bit of redness sometimes. I haven't seen anything major in terms of side effects with the ones that we mentioned on the slide just now. Once dosed properly and you follow the instructions, I would also recommend, these are just examples of ones that we use. And if it's something that you think you might benefit from, seek help from a qualified professional that understands these molecules. Because if done in the wrong sequence, they can cause issues. So we like to have conversations and get to the root as to why are you considering this therapy? What are you looking to achieve with this? And then we guide clients accordingly. Okay, first of all, we need to start with A, get the body ready to accept B, versus you thinking, oh no, I want B first. No, we have to follow the protocol because we don't want to set the body up for failure.
Right.
So it's something to be very, very mindful of. We're not saying just take them. No, get in front of someone who understands these molecules and who knows how to prescribe them.
And they're very personalized. It's not one fit all.
It's not, no.
There's some of them that are like BPC is kind of foundational where everyone can benefit. But some of the others may not be for everyone.
That's
so yeah, definitely you want to consult with someone who knows about what, that have been using these for a while.
Oh yeah. So benefits, we touched on this a while ago, Dr. B. Faster recovery, from injuries and surgery. Muscle growth is huge. I mean, who doesn't want more muscles, huh? Who doesn't? Come on. Improved skin, that glow that you can get. And I think probably the most important reason to consider is the immune system.
Yep.
This is your body's defense force. If that falls, you fall. So it's very important to do things to keep your immune system in check. Not to take a side road here, but people don't realize that you create cancer cells every single day. Every day, your body creates cancer cells. Or put it this way, cells go into a phase where they can become tumorigenic. But guess what your body does? The vast majority of us
zaps them.
Knocks it out. Now, if your body's in a chronically sickened state, or if you're giving your body toxins that helps to keep those cells around longer, this is typically where we see some of the cancer models coming out, or some of the cells lasting longer than they should. So most people don't realize that. Every single day your body creates cancer cells, but it's up to you to help the body destroy those cells. And sometimes some step through the cracks. And that's when we see things like, certain cancers kind of sprouting up. And we've gotten better in medicine to be able to track and find these things and get rid of them. But this is your body. You got to be vigilant and stay on top.
So here, as we spoke about already, just making sure that you work with a qualified healthcare provider.
Oh, yeah.
Proper dosing, administration, and that it is the right one for you. Following the protocols to prevent any possible side effects. And there's certain biomarkers for certain peptides that we have to monitor. So, again, if you're working with that healthcare provider who is versed in that, they'll know exactly what to do for you. And not going out there and just getting anything that you see on the internet. We spoke about this in the beginning.
Oh, yes.
Make sure you get it from a reputable source. In our practice, we have our own compound pharmacies that we have vetted. We have a good relationship with.
Yeah.
So we order, they're all from out of town.
Yes.
But we order them in so that we get the best quality for you. So whoever you'll be working with, once this is their field of expertise, they know where to get that compound, the pure form, without any fillers or anything or any concerns about you getting something that's
purity,
not flavoring.
exactly, yeah. Huge.
Yeah.
It's a wild, wild west in the peptide world.
It is.
Be very careful, guys. Be very careful what you get. But yeah, I love peptides. I think they're a game changer. They have changed my life. They've changed our lives. They've changed our patients' lives. I think it's awesome. It's awesome.
Let's go, Batman.
I'm Batman. See, like Batman, I work in black and sometimes very, very dark gray. For my Lego movie fans out there, my Lego Batman fans out there. Yeah.
Oh, that's awesome.
So peptides, this is what we do. Guys, drop us an email if you have questions about what peptides are or what you should be doing. amgvitalityvault@gmail.com. We'd love to answer them and get to know you guys some more, and keep subscribing. Share the podcast with your friends and family.
Yes.
We're here to help and educate. And that's the main reason why we're doing this, because we just want to be able to get people to have better conversations with their healthcare providers in terms of how they get themselves feeling and being healthier.
All right, we'll see you next time.
Take care, guys.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.